Good evening, ladies and gentlemen. My name is Robert Wright, and today I'll be discussing donning a surgical gown and gloves using sterile technique. Now, first of all, I need to establish that the reason why we don items sterile is because we want to protect our patient, as well as we want to make sure our environment stays microorganism free. So, let's get started. The first thing we're going to do is we're going to establish the supplies that we're going to need. The first set of supplies that we're going to need is going to be our goggles. We must wear goggles to protect our eyes. The next item will be a surgical gown. Surgical gown protects our person as well as continue establishing that sterile environment. We're going to need 2 pair of gloves. Once again, helping us protect our sterile environment as well as our patient. Now, the first thing we're going to do is open our gown. We're going to place our gown on a clean surface. And using technique, we're going to open our gown away from us, side, side, and towards us. Then we're going to project our gloves onto our sterile field, both the size 7.5 and 8 for myself. Of course, your surgeons will have their own preference, as well as any other technologies that may be assisting. Now, prior to placing sterile gowns and gloves on our person, we must do a surgical scrub, and we must do a surgical rub at any given time. Of course, you can refer to your textbook to give you further details. So, I have actually went and I've scrubbed my hands the appropriate amount of times. Now I'm going to pick up my gown. We must be careful when picking up our gown because we cannot touch anything within a 1-inch barrier around our drape. So I will pick up my gown, being very careful not to contaminate. Now, I'm not going to have on my mask at this time because I must talk with you, so I want to make sure that you understand everything that I'm saying. So I'm going to forego the mask, but a mask is required for any surgical procedure. Now, I'm going to open my gown, let it fall to the floor. Like a fish, I'm going to swim from side to side. I don't want to extend my fingers outside of my cuff. Now, I'm going to pick up my first gloves, which will be my larger gloves. Now, as you can see, I was just checking to see if you all were watching, but I did not dry my hands. We will dry our hands prior to putting our gown and gloves on, but no one said anything, so I feel that my class, I'm going to have to give you a little quiz. Okay, moving right along. I'm putting on my 8 gloves, being careful not to go 1 inch past my barrier, as well as not touching any of the stainless steel table. Thumbs down, fingers towards me. I'm going to put my gloves on. Once again, these are my size 8 gloves. The larger gloves go on first, and the smaller gloves go on afterwards. Thumbs down, fingers towards me. My other 8 gloves. We try to put on the right and then the left glove, but of course that's your preference. Being careful not to touch. I'm going to pick up my 7.5 gloves, and I am going to go thumbs down, fingers towards me. Of course, you don't want to do that. You can place your gloves on your hands because you already have a sterile barrier, which is your first set of gloves, but I want to try and show you the right way at all times. Thumbs down, fingers towards me for my left gloves. Now, once I have placed my left glove, my right glove, for my right glove, my left glove, for my second pair of gloves, I have now almost completed my donning of a sterile gown and glove. Last but not least, I must take my card and I will hand it to my circulator, who I will actually stand still while he or she walks around me so that I may secure my tie and make sure that the back of my gown is not showing. Now, once again, we have placed our gown and gloves on using technique to prevent a hospital-acquired infection as well as a nosocomial infection. Nosocomial infection and hospital-acquired infection. We have went and placed our gloves and our gown. We've opened them to make sure that they do not extend 1 inch around the border. And we've also did a surgical scrub. Now, I'm asking from the audience, do we have any questions? Now, the test for you is, I want you to write down everything that you've seen me do right and everything that you've seen me do wrong. So if I have no further questions like I've asked previously, hey, have a great evening. And I hope to see you in class on the next day. Good night.